Yes, and I've made another transition in that time as well. I've gone from working at the national level at the Australian General Practice Network and the Australian Medicare Local Alliance, which is closing its doors today, as you say. I've made the transition to working translating a lot of the primary healthcare reforms that have been occurring over the last 3 years at the local level here in the ACT, and that's been fabulous transition for me. Because I suppose it's sort of put me front and centre at looking at what we can do in the ACT to tackle some of those wicked problems in our jurisdiction that we're talking about today. All of you in the room have been around as long as I have, I'm sure, in various roles in this sort of broad health and social care sector, and we talk a lot about those wicked problems. We've talked a lot already, and we've had Richard and others comment about siloed program delivery and needing to be, Chris Burke with the Human Services Group here in the ACT also, shifting the thinking and shifting the paradigm so that we're focused on people or families, the recipients of services, rather than the way programs, rather than thinking of programs and funding in silos. So I'm really excited about Partners in Recovery because I think at a sort of microcosm level, in a way, it is showing some promise, and I can take you through, and that's what I'll do today, how we've approached the implementation of Partners in Recovery in the ACT, and it is showing some promise it's provided us a platform really here in the ACT about new ways to fund and integrate services. We're only just over 1 year in. We started service delivery in October last year, but there was a lot of pre-work before we got to that point. And the community-based and clinical and community-led governance arrangements that we've got around this have been a fairly critical enabler. Before I go into the brief talk I wanted to give today, I also wanted to acknowledge the traditional custodians of the land here in the ACT, the Ngunnawal people, and pay my respects to their elders past and present. So Partners in Recovery, I think the first point about it is it's more than a service delivery program. It is a new model of care, and I think it's in its conception, those of you that were familiar with the debates at the time, you may not be, and that doesn't matter. But it's been contested, it's been critiqued by some people, because it actually is, it's sort of case management, but it's not. Certainly not clinical service delivery. It has at its heart a workforce of support, what we call support facilitators. I suppose in summary their role is to serve as service coordinators for people with severe and enduring mental illness. So we're talking about a very, very, very targeted program here in the ACT. We're aiming to work with about 430 people and their families who are experiencing severe and enduring mental illness. It has a complex interface with the NDIA that we're still working through at the moment, but probably won't dwell on that side of it. But why is it more than a service delivery program? It's more than a service delivery program because it's got the potential to change systems. The reason it's got potential to change systems, and we're delivering it differently, we're organising it differently to other regions in Australia, but here in the ACT we are working cross-agency, so we have a consortium or a local service network that brings together the Medicare Local, lead GPs that are involved in mental health, primary mental health care improvement through the Medicare Local, and a network of about 12 community-based agencies who are involved in various ways in mental health service delivery. So there might be the Carers ACT, for example, part of that mix, through to agencies like Belcon and Community Services who deliver HAC services, targeted programs for people with mental illness, homelessness services, those sort of broad spectrum community agencies. The other reason it's got potential to change systems or strengthen systems is because the Medicare Local, we see ourselves as an organisation that doesn't do direct service delivery here in the ACT. We see ourselves more as a commissioning agency or an enabling organisation, so that we are using funding streams that we have, networks that we have, clinical leadership and community sector relationships that we have to look at ways of funding or integrating services so that the response overall is better. So the fact that we have program funding from the Commonwealth and some philanthropic funding for mental health service delivery and some ACT government funding for mental health service delivery in terms of procuring and commissioning and better coordinating that gives us the opportunity to nest or think about how we plan those services. ATAPS is one of those, Access to Psychological Services program. We call that Health in Mind here in the ACT. We've got a program called New Access, which is a low intensity psychological service funded. It's the first national demonstration of that model of care funded by Beyond Blue and Movember. But it allows us to bring, as a sort of neutral broker type organisation, bring initiatives like Partners in Recovery and other funded mental health programs that have a service delivery dimension, try to be thinking about them in a service development sense as part of a step up, step down model of care. So that's, when I say change systems, we don't conceive of New Access, or we don't conceive of ATAPs, or we don't conceive of Partners in Recovery in isolation of their relationships to other services. We have government, both local government agencies, Community Services Directorate and ACT Health, who fund and provide services. We also have the NDIA, who have a local footprint here now with starting operations next week, and the Federal Department of Human Services, who have a regional and service delivery footprint, also involved in that consortium. So it is a platform where we can have those discussions about where are there deficits in the system, and Partners in Recovery might not be able to finance or fund those, but we certainly have a platform there with service, through that service network, where we can develop, put up propositions for service development or system development ideas and take those forward in collaboration with agencies like the Community Services Directorate. I think the Human Services Blueprint, the single human service system that the ACT government have released in recent weeks that Chris Burke spoke about, provides enormous opportunity in a jurisdiction like the ACT, and we are, because of our size and our geography, some of those characteristics that Chris Burke talked about, we can be quite a good incubator for innovation. And I think with the Human Services Blueprint and the platform that provides us to be thinking about, in the context of the local services network demonstration that Chris talked about, where in West Belconnen the intention is there's going to be a local governing group of community agencies making decisions, looking at the data, looking at what the pressure points in that West Belconnen area are, and really shaking the system up, tipping it up, letting it all spill down, tip it up and turn it upside down, and look at how the funding and the services could be better pooled, differently pooled, better integrated or differently integrated, I think is an enormous opportunity. And to the credit of the ACT government, they have recognised we're often struggling to put the point that, as Richard Di Natale said, general practice, they see a lot of people in the community, as Andrew Lamming said this morning, as a country GP, often GPs are very isolated, and they struggle as much with knowing the range of services, supports and referral pathways that are out there for them, particularly in response to families and people with complex needs, multiple morbidities, health and social care morbidities. So the fact that the ACT government, in designing the Human Services Blueprint, got it, that integrating primary health care into the way the Human Services Blueprint is delivered in a practical sense on the ground is fundamental. I mean, if we don't get that right, we may as well go back to the drawing board if we're not connecting up at a fundamental level that really frontline health part of the health system. We're never going to get integrated health and social care. So I think that's a really good recognition. So where Partners in Recovery comes into that is that through the governance arrangements we've got set up there, because we've got that service network in place, empowered, and in the early days we used a lot of the collective impact thinking to set the culture, I suppose, for that consortium. That's a sort of ready-made group with pretty good levels of trust and pretty good levels of commitment to have a robust discussion about where the deficits are in the system and what needs to change. Why are Medicare locals recipients of funding like Partners in Recovery, I suppose, is a sort of first principle question. We're obviously going to be downplaying the fact that we're called a Medicare local. We prefer to call ourselves Canberra's chief primary health organisation because in functional terms we are a primary health organisation. Under the new government's policy, Medicare locals will not be funded from July next year, but there will be a public tender process to form primary health networks, replacing Medicare locals. Fundamentally, very, very similar roles around an organised meso-level structure for coordinating, integrating, commissioning, and working, as we do passionately to sort of ensure that the health system has a skew towards primary health care and that we're not driving people into the hospital all the time. So as a Medicare local, our mission is really simple. Our mission is to keep people well and out of hospital. That's the litmus test we put on anything we do, and which is why we're a recipient of Partners in Recovery funding. We had to tender to get that funding, so it was a contested process. So we're really working to the triple aims of better health care, better health, better care and better value. And one of the things in our strategic plan at ACT Medicare Local, our second key objective area is whole person, whole system. Again, that's the lens we put on everything we do. And I can't see that philosophy changing under, as we transition, and we hope to tender, and we certainly do hope to transition into a primary health network. But I think that whole of system focus and getting the whole of system working better in integration terms, integrating health and social care, better integrating transitions of care between health and acute health are going to be, if anything, more prominently or more sharply focused in the primary healthcare network world, which I think is a good thing. So Partners in Recovery, its broad objective really is about for those 430 Canberrans, and we've got about 120 of those currently on our books, so to speak, as active clients. The purpose is really to support them with wraparound care. The focus is on looking at all their risk factors, look at all their experiences of the system, looking at their diagnoses and linking them up with that support coordinator, as we call it, it's a little bit akin to the lead worker concept that Chris Burke was talking about with the Strengthening Families initiatives. The idea with the support coordinator is that it is a person qualified in welfare and that sort of work. They're not clinicians who will walk alongside that person and link them up to housing services, link them up to healthcare services that they need, link them up to culturally specific services that they might need, link them up to employment services, link them up or assist their exit out of the justice system, link them up to Centrelink and the social welfare system. So it's a very fluid role and obviously a very fit-for-purpose, bespoke role that's really determined. I mean, what the support facilitator does on a day-to-day basis is determined by the person's needs. It's as simple as that, really. In the ACT, as I said, we are the lead agency. But by that I mean we're not the all-knowing agency, but we are the agency that holds the funds that plays an organising role in terms of getting the service providers, service networks together, getting the right clinical advisors, service development advisors together so that we could come up with an operational model that was fit for purpose for the ACT. We contract with 6 agencies around Canberra, Catholic Health, Belconnen Community Services, Richmond Fellowship, just trying to remember them all, there's about 6 of them, Woden Community Services. So the support facilitators are nested in their service architecture, the services they provide. But across Canberra, the support facilitators are supported by us to form a service delivery network of their own. So they do a lot of case discussion and joint training and development, those sorts of things. Okay. At the governance level, I started out talking about the governance arrangements we've got around this, and I think it's really important. It sounds boring, you know, when you talk about governance, what does that mean? But what that means for us is we've got 3 levels of governance supporting the implementation of Partners in Recovery. We have a Partners in Recovery operational team. That's where the basic design of the way we were going to operationalise the service was developed and is monitored and tracked and continues to be planned. We have the consortium, which is that higher level group I was describing. And then we have a mental health strategic oversight group, which is very much a joined up governance arrangement with ACT Health and ACT Mental Health Services, and increasingly NDIA starting to start come into the picture there, so that we've got that higher level coordinating mechanism. We've received about 132 referrals since October. We've got about 120 active participants at the moment, so actively working with support facilitators. The sort of referrals, probably no surprise for you to hear where the referrals are coming from. They're not coming from general practice, which is probably what you'd expect. They're coming from housing and housing support services. Direct referrals are obviously enabled through this. There's no sort of GP gateway or anything like that. That wasn't appropriate. Self-referrals are a big one, and referrals from community mental health services like the crisis assessment teams and those sorts of services. So, you know, it's really there providing that safety net. I think you were mentioning the gentleman before, you know, talking about where do people go when they're being discharged, you know, or what's available to a crisis and assessment team worker who's gone out and done a psychiatric risk assessment. They're not deemed to be not at risk of suicide, but that day or that night. But boy, oh boy, there's a whole package of issues and needs there that need unpacking and need support. So it's providing a pathway in the community that wasn't there before. And we've got some testimonials. I just wanted to share them with you because I think that it's the personal stories that matter when you if you're ever looking for feedback. And we are doing a local evaluation of Partners in Recovery in the ACT through the Centre for Mental Health Research at the ANU. And we're obviously participating in the national evaluation, but we did want to do our own local evaluation as well. But just some of the testimonials to share with you. One participant said, without Partners in Recovery, I would be in jail. Another one said, Partners in Recovery has been the best thing to happen to my son. So that was from a carer, from a parent. So it really is, and that's only since October when we opened the doors on this program. It's starting to have that sort of impact on people's lives. And, it is only a small program, but I think when you think about it in terms of where it fits in the scheme of things and how we've taken a long time. We took 12 months before we really opened the doors to make sure that we had those connections and relationships so that those referrals were able to come in quickly and from the right point, and that the awareness of what Partners in Recovery offered was there. The other really important contribution that the support facilitators as a workforce have made to the work of the Medicare local, but also to some of the leverage points that we have as a primary healthcare organisation. We've just completed a comprehensive needs assessment across the ACT. That's the basis of all our planning, the basis of all our advocacy, the basis of all our sort of shared system and service development work with ACT Health and Community Services. The support facilitators and their first-hand experience of the field, their clients and the circumstances of their families was a really valuable input, qualitative input to that comprehensive needs assessment. I suppose that's really the fact that we've got that data there now, we've done that needs assessment, that's really our next phase of activity with Partners in Recovery. We've got the operations sorted. We've got a consortium now very actively saying, well, we started off looking at this in a collective impact framework and thinking about what we could do in the ACT to improve the mental health system, to improve health and social care integration as far as it relates to people with severe mental illness. We're sort of ready to get on now, or resume thinking about what we can do around some of those wider system issues. So some of the top needs, and again this won't be new to any of you, some of the top needs that both the comprehensive needs assessment as a whole, which drew on a lot of data, that drew on a lot of focus groups and community forums, in addition to the sort of very targeted sets of inputs we got from the support facilitators, identified for us that people with a mental illness in the ACT, and this is not just at the severe end either, it's people, you know, with any relationship with the mental health system, or anyone that has had a relationship with the mental health system. The really 5 big issues for them are information, choice and control. You would think in a jurisdiction like Canberra, we are very, very resource rich in terms of services. It's the knowledge about those services, both in the general practice community and the referrer community, but in the potential client base for those services that just don't know. How do I access X? How do I get to that? What's my eligibility? So we've got really disaggregated, fragmented service system, but probably a good service system overall. It's just knowing how to navigate it. And for people with complex chronic conditions, the wherewithal to navigate the system is obviously impeded by the circumstances they find themselves in, and if they don't have a good carer or a good family member, then we're not starting off on a very good footing. So information, choice and control, very big issue. And the one big plea we had was, why do we have to have all these myriad of service directories? We've got service, Health Service Direct. We've got Citizens Advice Bureau, we've got CSD over here wanting to sort of generate a single service gateway supported by an information resource. We've got Carers ACT funded through CareLink to have a comprehensive searchable database of disability aged and mental health services. Where would you start if you needed to start somewhere? Why can't we have, in a jurisdiction of this size, a single integrated health and social care service directory? So that was one really big plea, and we've given, certainly our clients in Partners in Recovery, those 120, but through our community needs assessment, which we will publish in the next month or so, we'll be giving a commitment back to the community and the clinicians that plead. That was their one plea among many, that we would take that up with the ACT government, and we've already started having those discussions. It can't be that hard. Other issues were around priority access, and this has been an enormous frustration for the support facilitators, as you can imagine. To task someone like a support facilitator to work with a client with severe and enduring mental illness who has butted up and been rebutted by the housing system and the Centrelink system and all of those systems of care that they really need, packaged up for them, and given up or got completely frustrated or have been on the wrong door wheel or the merry-go-round in and out, it's almost like setting the impossible task. So what we've started to do is have some conversations with the Community Service Directorate, who are running the Strengthening Families initiative, because what they do with the lead worker that Chris Burke described with that initiative is that they have an arrangement where the lead worker has a special authorisation. So I suppose another way, it's sort of like a fast track arrangement where they can get some service guarantee that they can fast track the really, really high need families that they're working with. So we thought, well, chances are that the support facilitators for Partners in Recovery are going to be working with probably a bit of, an overlap in that cohort. Could we not look at getting a similar authorising environment for the Partners in Recovery support facilitators, so they can, or their clients, can experience the same sort of fast-track experience into the system. Tenancy support is another really big issue, so we're looking at what we might do and how we can support that. Access to peer workers and support workers with outreach capacity. There is a peer workforce in Canberra, but it's really limited. What we're hoping to do with the flexible funding that's available to us through Partners in Recovery is to extend that workforce, because the focus is on recovery, and that's the feedback from a lot of the participants that when the support facilitator exits, and that's not a quick exit, what are the peer support and other family and social supports around me to assist me in my recovery and to stay on a recovery path. So we want to make some investments over the next year in developing and extending the available peer support workforce we do have in the ACT. And then the final thing we'll be working on, and again this is just to illustrate to you how we've done a needs assessment, so in addition to the service delivery that we're offering through Partners in Recovery, how we're picking up on our needs assessment to look at influencing some and changing some of the way some of those things at the system level, how they're organised or how they could be better extended or integrated. We want to do some work to support carers in this space. We don't know what that will be yet, but there's been a strong plea to us to do something about that. So we'll be having some consultations throughout this next year, well, not consultations throughout this next year, consultations early in the year, with a view to offering a practical program or some program enhancements to existing programs, which is always our philosophy as a Medicare local. We don't want to reinvent wheels. We don't want to duplicate. Resources are too precious to do that. Our commitment is to really, if there's a good program out there or the seeds of an idea, let's extend and work with that rather than act in isolation and duplicate it, particularly if it's not in an area of expertise for us. So I think I might leave it there, really. So I guess in summary, I do think Partners in Recovery is a very hopeful example of how when you do get funding from the Commonwealth, it does have a level of flexibility around it, because there's quite a reasonable amount of flexible funding available through the Partners in Recovery funding stream. That was the intent, that you can, if you've got the right governance, the right clinical and service provider networks, and the right client and consumer engagement, you actually can, get organised pretty quickly, and you've got good data and needs assessment backing that up, and the cooperation of a jurisdictional government, which is what we've got here in the ACT, certainly can mobilise reasonably quickly to make some impacts on the system. So I suppose the way we think about the approach we've taken with Partners in Recovery, just to conclude and summarise, the way we see ourselves as ACT's chief primary health organisation is we are a commissioning organisation. We are sort of an enabler of system change, or a stimulant for system change. Obviously having a bucket of money helps with that, but I think money's not the only enabler there. The enablers that we've built into the Partners in Recovery implementation model include integrated services, collaboration across sectors, across providers, communication, again, across services providers, the system, at an agency and service provider level, and increased capacity. So having a consortium of decision makers and a new workforce of 12 support facilitators, that's made an enormous difference to capacity in the service system here in the ACT of itself. But already, October 2013 was when we started service delivery. not much more than 6 months down the track, we've already, I think, started to leverage quite a lot of additional value add out of that. So I think it's an example of how we can approach health and social care integration with the right ingredients in place. Thanks, Mel.
Thanks, Leanne. Thank you so much for that.